How can nurses deliver more effective and holistic care to patients? What methods can we utilize to make this happen? How can we build an effective relationship with the patient while acknowledging their cultural backgrounds and conditions? As healthcare students and workers, we must learn how to successfully address the complex needs of our patients that may be different for each individual. By implementing a specific approach in the delivery of healthcare, we can ensure our patients receive comprehensive care. And what approach is that? Person-centered care. Person-centered care is a holistic care approach heavily based on concepts including collaborative partnerships between patients and healthcare professionals, and acknowledgement of patient beliefs, values, and preferences. It seeks to depart from the traditional paternalistic approach to healthcare and instead provide individually tailored care that enhances patient satisfaction and well-being. These can be displayed in a healthcare facility where nurses work with patients' beliefs and values, engage authentically, are sympathetically present, share decision-making, and provide holistic care, hence upholding the concept of person-centered care. Our own professional values such as respect, compassion, and dignity are at the core of person-centered care, as well as our capacity as healthcare professionals to individualize care. Without the person-centered care approach, a respectful and trustworthy relationship with patients cannot be established and may lead to conflict, confusion, and discomfort. According to McCants and McCormack, there are 4 domains to the person-centered care framework. The first domain is prerequisites. Prerequisites include established skills and qualities that staff must possess, including professional competence, effective interpersonal skills, and commitment to the job. The second domain is care environment. This is the context the care is performed in, and this could include an appropriate staff skill mix, the effectiveness of staff relationships, and the organizational systems of the healthcare network. The third domain is person-centered processes. This involves care that integrates concepts such as understanding and working with patient beliefs and values, involving the patient in decision-making processes, and the healthcare worker's engagement in the care. The final domain is expected outcomes. This domain establishes that the outcome of care should result in patient satisfaction. A therapeutic environment should have been established during the care. The patient should feel that they were involved in the care and have a general feeling of well-being. The Australian Nursing Standard Assessment Tool, or the ANSAT, is a clinical practice assessment tool based on the standards defined by the Nursing and Midwifery Board of Australia, or the NMBA. The ANSAT contains 7 domains that a nursing student must demonstrate in order to pass the assessment. In this video, we will discuss the third domain, maintains capability for practice, and how this relates to person-centered care. Maintaining capability for practice is essential to delivering person-centered care, as it demonstrates a commitment to quality nursing practice, which is a prerequisite for person-centered care. In order to fulfill this ANSAT domain, a nurse will need to ensure they demonstrate skills in health education to enable people to make decisions and take action about their health. This ensures that the nurse has the ability to effectively communicate issues or ideas to the patient. This is directly linked to the effective delivery of person-centered care, as it enables the nurse to integrate the patient into decision-making processes to ensure that the patient's own preferences are acknowledged and fulfilled. Additionally, educating a patient on how to self-evaluate allows the patient to take control of their care and maintain their independence, which can be extremely valuable and empowering to an individual. A commitment to lifelong learning is also essential to this process. Commitment to lifelong learning and development is necessary to maintain professional competence, which is a foundational element to person-centered care. You need to keep up to date on relevant skills and learning in order to deliver care effectively, ensuring you are keeping the patient safe and fulfilling their individual needs. Encouraging the learning of others, such as your co-workers, is also important in person-centered care to ensure that your team is supporting learning development and working together to achieve the patient goals. Demonstrating accountability for actions and decisions in your role is also intrinsic to person-centered care, as it is foundational to professional competence. Possessing the relevant knowledge and the ability to justify your delivery of care enables you to perform safely and enhance patient care outcomes. Being able to effectively communicate these rationales to the patient can also help the patient to feel more involved in their care and as a result improve the patient experience. Reflecting on practice and responding to feedback is essential to developing these skills. It allows us to acknowledge areas of weakness and further strengthen the delivery of person-centered care. Reflecting on our practice may also help us recognize situations where we have let prejudices, stereotypes, or assumptions dominate our way of perceiving and responding to a patient. Therefore, self-reflection aids us to practice cultural safety, ensuring our patients feel comfortable and respected in the healthcare environment. According to Kowalski, there are 3 types of feedback. Positive and affirming feedback reflect on an individual's strengths and abilities and motivate them to strive for excellence. In many student-nurse relationships, constructive feedback focuses on the development and growth of the student, whilst highlighting any errors that can be corrected in the process. Negative feedback is often avoided as this often dominates and diminishes an individual's potential, often resulting in the damage of one's self-esteem. It is highly noted that feedback is considered one of the most intricate and challenging interactions between individuals and is almost inevitable as student nurses. Feedback is essential in the sense that it develops effective strategies for providing person-centered outcomes. According to Kowalski, receiving feedback as a student nurse allows for, and is not limited to, accepting and integrating learned information from others. This highlights feedback more as a conversation for growth and development, rather than an attack on an individual. In practical situations of placement, feedback allows individuals to set goals to achieve person-centered care outcomes for patients. Student nurses have the ability to incorporate their learned information while testing how well they react and respond to their previous errors or mistakes. The acceptance and integration of feedback is fundamental in order for a nursing student to provide person-centered outcomes. To this, further collaboration should be promoted in conversations for a healthy understanding and reflection on one's own performance, as well as the feedback received. Maintaining a positive mindset during feedback is beneficial as it improves self-esteem and provides development for healthy and meaningful relationships. An early grasp of this strategy will initiate a commitment to acquire the nursing skills and accountability needed to pursue professional development. In doing so, constant interaction between colleagues and an openness to others' opinions will become natural and motivating during clinical practice. During clinical placement, constant self-evaluation and seeking of feedback enhances the overall performance of a student nurse through person-centered care. Kowalski states that striving for improvement can broaden one's creativity, increase the quickness to adapt to different positions, and raise the satisfaction of performance. As a result, student nurses are more experienced in relationships across a health setting, able to adapt to individual patient needs, and willing to reinforce skills through feedback, either from facilitators or patients. In understanding that holistic care should be provided without diminishing the care given to the patient, a nursing student should be welcome to any point of view. Not only does this advantage the professional growth of the student nurse, but it also allows the patient to feel involved and have a positive patient experience.